The most important thing that a patient and their caregivers can do to ensure that a wound will heal is to be compliant with the treatment that's been ordered. It's interesting that we go out, we educate the patients and the caregivers on the things they need to do to make things better for them, and sometimes, unfortunately, they either don't hear it because they're stressed out, or they think, well, my grandma didn't do it that way, so they end up doing something totally contrary. So the next time we go in, we've made very little progress with the wound. So it's a case of please do as I say, because it's good for you, not because it's good for the home health team. Signs of infection or trouble with the wound would include increased pain in the area. You need to be very aware of that. If the skin is suddenly warm to touch where it hadn't been before around the wound, redness around the wound where it hadn't been red before, drainage that's changed or has a foul odor, and certainly a temperature over 100. The most important things that a patient and their caregiver can do to impact their wound healing is to look at the nutritional status. As long as they're not on a protein-restricted diet, they need to increase their protein. Eggs, milk, cheeses, meats, because that improves their wound healing status. Cleanliness, obviously. There's not a thing wrong with soap and water. People used to think, oh, don't get it wet, don't get it wet. But frankly, on a chronic wound, a wound they've had for greater than 6 weeks, soap and water is their best friend. It really is. I will oftentimes call the doctor and will recommend just wash it with soap and water before we do anything else to it, just to keep it clean. In an ideal situation, the patient can be compliant with their wound care. We can impact their wound healing times by we can cut it by 50%, the time it would ordinarily take to heal a wound.